7 personal hygiene mistakes elderly make that doctors notice immediately. Number 4 is shocking. Hey there, my wise and wonderful friends. Welcome back to the channel, where we share tips, tricks, and life lessons to help you live your healthiest, happiest life in your golden years. I'm so glad you're here today because we're diving into a topic that's super important but often overlooked: personal hygiene. Now, I know what you're thinking. Hygiene? Really? I've been taking care of myself for decades. But stick with me, because even the most diligent among us can slip into habits that might not serve our health as well as we think. As a doctor who's worked with seniors for years, and as someone who's had countless heart-to-heart chats with friends and family in their 50s, 60s, and beyond, I've seen firsthand how small hygiene mistakes can make a big difference in how we feel, how we age, and even how doctors perceive our health. Today, I'm sharing 7 personal hygiene mistakes that doctors notice immediately when they see elderly patients. Some of these might surprise you, and number 4, it's a real shocker. My goal isn't to make you feel bad. It's to empower you with simple, practical advice to keep you feeling confident, healthy, and vibrant. So, grab a cup of tea, get comfy, and let's dive into this like we're old friends catching up over coffee. By the end of this, you'll have some eye-opening insights and easy fixes to make sure you're putting your best foot forward, literally and figuratively. Ready? Let's get started. Mistake number 1, skipping regular showers or baths. Let's kick things off with something that seems obvious but can sneak up on us: not showering or bathing as often as we should. As we age, it's easy to think, I'm not as active as I used to be, so I don't need a shower every day. Maybe you're saving energy, or perhaps getting in and out of the tub feels like a chore. I get it. Life changes, and so do our routines. But here's the thing. Doctors notice right away when someone hasn't been keeping up with regular bathing. It's not just about odor, it's about skin health. Our skin is our body's first line of defense against infections, and as we get older, it gets thinner and more prone to issues like dryness or irritation. Skipping showers can lead to a buildup of dead skin cells, bacteria, and oils, which can cause rashes, infections, or even pressure sores for those who spend a lot of time sitting or lying down. I had a patient, Mary, a lovely 72-year-old who prided herself on her independence. She told me she only bathed once a week because she didn't want to overdo it with her sensitive skin. But she kept getting itchy rashes that turned out to be caused by bacterial buildup. Once we got her on a gentle, twice-weekly shower routine with mild soap, her skin cleared up and she felt like a new person. Fix it. Aim to bathe at least 2 to 3 times a week, using lukewarm water and a gentle, fragrance-free cleanser. If mobility is an issue, consider a shower chair or a handheld shower head. Your skin and your doctor will thank you. Mistake number 2, neglecting oral hygiene. Next up, let's talk about something doctors notice the moment you open your mouth: oral hygiene. Brushing and flossing might feel like second nature, but as we age, it's easy to let these habits slip. Maybe your hands aren't as steady, or you're dealing with dentures, or you just don't think it's as important anymore. But poor oral health can lead to serious problems, from gum disease to heart issues. Yes, you heard that right. Studies show that bacteria from gum disease can travel through your bloodstream and contribute to heart disease. I remember chatting with a patient, Tom, a 65-year-old retired teacher. He was sharp as a tack, but admitted he only brushed once a day and rarely flossed because he found it tedious. His dentist noticed receding gums and early signs of periodontal disease, which could have led to tooth loss if left unchecked. We worked together to make oral care easier: electric toothbrushes for better cleaning and water flossers for simplicity. Within months, his gums were healthier, and he was smiling brighter than ever. Fix it. Brush twice a day with a soft-bristled toothbrush. Electric ones are great for arthritis. Floss daily, and consider a water flosser if traditional flossing is tough. Don't skip those dental checkups. They're not just about cavities. They're about your overall health. Mistake number 3, overlooking foot care. All right, let's talk about your feet, those trusty companions that have carried you through life. Foot care is one of those things that doctors notice immediately, especially in seniors, because neglected feet can signal bigger health issues. As we age, circulation slows, and conditions like diabetes or arthritis can make foot problems worse. Cracked heels, untrimmed toenails, or fungal infections are red flags for doctors. I had a patient, Susan, who was 68 and loved her daily walks. But she came in complaining of foot pain, and when I checked, her toenails were overgrown and curling, causing pressure and sores. She admitted she hadn't been able to reach her feet comfortably in years, and was too embarrassed to ask for help. We got her set up with regular podiatrist visits and some simple tools like a long-handled nail clipper, and her walks became pain-free again. Fix it. Wash and dry your feet daily, especially between the toes to prevent fungal infections. Moisturize to prevent cracks, and trim nails straight across. If you can't manage foot care yourself, don't be shy. Ask a family member or see a podiatrist. Your feet deserve some TLC. Mistake number 4. Using harsh soaps or over-cleaning sensitive areas, the shocker. Here's the one you've been waiting for. The shocking mistake that doctors notice instantly. Using harsh soaps or over-cleaning sensitive areas, especially in the genital or perineal region. I know, it's a bit awkward to talk about, but hear me out. Many seniors think that using strong soaps or scrubbing vigorously is the best way to stay clean, especially if they're dealing with incontinence or sweating. But this can strip away natural oils, disrupt the skin's pH, and lead to irritation, infections, or even painful skin breakdown. I'll never forget a patient, John, a 70-year-old who was meticulous about his hygiene. He used antibacterial soap and scrubbed thoroughly every day, thinking he was doing the right thing. But he developed severe redness and discomfort in his groin area. His dermatologist pointed out that the harsh soap was destroying his skin's protective barrier, making him more prone to infections. Switching to a pH-balanced, fragrance-free cleanser and patting the area dry instead of scrubbing made a world of difference. Fix it. Use mild pH-balanced cleansers for sensitive areas and avoid scrubbing. Pat dry gently with a soft towel, and consider a barrier cream if you deal with incontinence. Less is more when it comes to cleaning delicate skin. Mistake number 5, ignoring hand hygiene. Hand hygiene might seem like a no-brainer, but it's another area where seniors sometimes slip up. Whether it's forgetting to wash hands after using the bathroom or before eating, or not washing thoroughly enough. Poor hand hygiene is something doctors notice because it can lead to infections that spread quickly. As we age, our immune systems aren't as robust, so those little germs can cause big problems. I had a friend, Linda, who was 62 and loved gardening. She'd come in from her yard, grab a sandwich, and not think twice about washing her hands. She ended up with a stubborn skin infection that traced back to bacteria from her garden soil. It was a wake-up call for her to make hand washing a non-negotiable part of her routine. Fix it. Wash your hands with soap and water for at least 20 seconds, especially after using the bathroom, before eating, or after being outdoors. Keep a gentle hand sanitizer handy for when you're on the go. It's a small habit with big benefits. Mistake number 6, not changing clothes regularly. This one might catch you off guard, but doctors often notice when someone hasn't been changing their clothes regularly. Maybe you're wearing the same comfy sweater for days because it's cozy, or you're re-wearing socks to save on laundry. But clothes trap sweat, bacteria, and odors, which can irritate your skin or make you feel less confident. I had a patient, Robert, a 67-year-old widower who lived alone. He admitted he'd wear the same shirt for a few days to stretch out his laundry days. He started noticing skin irritation under his arms, and his doctor pointed out that bacteria trapped in his clothes were to blame. Once he got into the habit of changing daily and doing smaller, more frequent laundry loads, his skin cleared up and he felt fresher. Fix it. Change into clean clothes daily, especially underwear and socks. If laundry is overwhelming, try breaking it into smaller loads or asking for help. Feeling fresh starts with what you wear. Mistake number 7, forgetting to clean personal items. Last but not least, let's talk about the things you use every day. Your glasses, dentures, hearing aids, or even your phone. These items can harbor bacteria, oils, and grime, and doctors notice when they're not clean because it can lead to infections or skin issues. For example, dirty dentures can cause oral infections, and grimy glasses can irritate the skin around your nose and ears. I remember a patient, Ellen, who was 74 and loved her stylish glasses, but she kept getting small sores on her nose bridge. Turns out, She hadn't cleaned her glasses properly in months, and the buildup was causing irritation. A simple routine of wiping them daily with a microfiber cloth and mild soap solved the problem. Fix it. Clean your personal items regularly. Wipe glasses with microfiber cloth. Soak dentures in a cleaning solution, and disinfect your phone with a gentle wipe. It's a small step that keeps you healthy and polished. There you have it, my friends, 7 personal hygiene mistakes that doctors notice right away, and simple ways to fix them. From showering smarter to pampering your feet, these tips aren't about perfection. They're about helping you feel your best so you can keep living the vibrant, joyful life you deserve. Aging is a privilege, and taking care of ourselves is how we make the most of it. I hope you found this chat as helpful as I found it fun to share. If you've got a hygiene tip that's worked wonders for you, drop in the comments. I'd love to hear from you. And if you enjoyed this video, don't forget to give a thumbs up, hit that subscribe button, and ring the bell so you never miss a dose of wisdom for your golden years. Here's to healthy aging, timeless wisdom, and living life to the fullest. See you in the next video.